Okay, just see, just gently stretch the foot, very gently. Okay, can you see a posterior crease over there? Can you see a crease over there? Is anything present?
Look at this, focus on this.
Okay, is anything present? No, no, don't let the child push it into like this, then it becomes, now what is it is? This is not the crease.
Not the crease.
Okay, if you let the child plantar flex, a crease will appear which is not a true crease. So, gently dorsiflex it, and now the crease is gone. So we have a posterior crease of 0. Okay. If there are fine creases present, that is 0.5. If a deep crease is present, that is 1. Okay. Next, move on to. I am not going in a sequential way because he is holding the child. Let's look at the equine. Okay. Okay. Again, a gentle push. I am not able to correct it. If I can bring it to the neutral position, it will be 0.5. If I can bring it to dorsiflexion, then it will be 0. Right now it's 1. Okay. Again, in this position, I would like to see the empty heel sign. Here. Okay. So there are 3 signs here. Okay. If you feel the pulp of your thumb, the bone is very deep, that is 1. Okay. If you feel like here, the tip of your nose, okay, after deep palpation you are able to feel your nasal bone, that is 0.5. And when you touch your forehead, the bone immediately comes beneath, that is 0. Okay, so in this child, I cannot feel the bone, so it's 0. It's 1. Okay. Now in the same position, let's see the medial crease. Okay. I will not stretch it much. Okay. Can you appreciate? Can anyone tell it what it is? What is the score? 1. So there is a single deep crease present. So it's 1. I can show you the other forms. Okay. This is 0.5. Multiple fine creases, and if this can be fully stretched out, then it's 0. How many signs remain? 2. Okay.
आगे ना यहाँ बैठ जाओ, बैग नीचे लटका के उधर बैठ। माँ लेके बैठ जाए।
This side I have already shown you. Okay. You put a finger here. If there is a deviation from the calcaneum onwards, that is input, then the score is 1. If the foot moves from the metatarsophalangeal joint, then it's 0.5. If I can fully straighten it out and a bit lateral, then it's supposed to be 0. Okay. Now for the last time, talar head sign. Okay. Start moving your finger downwards and medially. You will feel the talar head. Don't confuse this as a talar head. This is the callosity. This is a walking child. The talar head will be found here. Okay. And you have to stabilize the foot, rest of the foot, so that you can move your foot against the talus. Okay. So one hand on the talus, rest on the foot. If you can feel just the talar head and no other bone around it, then it's 1. If you can feel the portion of a navicular, then it's 0.5. And if you can cover the navicular over the talus, then the head is reduced and it will be 0. Okay. So that constitutes the Pirani score.